One of the biggest criticisms we see in the conspirituality space is that we must be shills because we think that vaccines work. Even though I know I've long been really critical of the pharmaceutical industry and the insurance industry and how for-profit healthcare works in America. And I think the same applies to psychiatric medications. I see it often in the conspiritualist space, all the way up to the level of RFK Jr. blaming mass shootings on antidepressants or on ADHD medications and such. And you once told me when we were talking via email that medications are one tool that you have in a broad toolkit. So I'd love to start a little more big picture here, and then we'll get more into your fantastic book. But what do you feel when you see someone like RFK or any of these influencers say, oh, people don't need psychiatric medication?
It drives me bonkers. It really bothers me because it has such downstream effects. It's pervasive. That kind of misinformation is pervasive in our culture. It's throughout social media. It's throughout popular culture. And then it trickles down to our healthcare systems, where I will have patients present to clinic repeating or parroting these kinds of anti-psychiatry tropes. And that's really what they are. They derive a trope as sort of a repeated theme or idea. And these kinds of tropes, for example, that antidepressants or psychiatric medications in general are harmful more than helpful, these get repeated and they affect decision making. And I think that's very dangerous. We see guys like Elon Musk tweeting that to hundreds of millions of followers. He'll say something like SSRIs, which are antidepressants, are more harmful than helpful, or that other particular kinds of medications are harmful. And I think that's, well, number one, it's just terribly misinformed. These guys, frankly, don't know what they're talking about. And when you go to, for example, me, I work in mainstream mental health care. I've been doing it for over 10 years. So my day job is to work in a what's called a concurrent disorders outpatient clinic. So it just means that people come to our clinic when they have concurrent addiction and mental disorders. And so I'm a clinical psychologist, and I get to work on an interdisciplinary team with other psychologists and psychiatrists and addiction medicine physicians and social workers and nurses and occupational therapists. And what we do on a day-to-day basis is we help people through what's called a biopsychosocial lens, or the biopsychosocial model. So we look to help people using biological interventions, which is kind of your medications, but then also your psychosocial interventions, which is psychotherapy and trying to connect people to a wider community. And so I, as a clinical psychologist, when someone calls me a shill, I laugh at that because I don't have prescriptive authority. I can't prescribe medications. So what I do every day is do psychotherapy and talk therapy. And yes, I will sit with patients and do a consult with a psychiatrist if we think a medication is helpful. But like you said, that's one tool in our toolbox. And lots of factors need to come into play when we're deciding on how to help people with their treatment plan, including the patient. They're obviously involved in steering how they want to proceed.
One aspect of influencer culture that we've identified as really compelling is the fact that they present with such certainty. And one reason I've always appreciated actual experts is that they have a little more humility. So in your book, you write, the current position of psychiatry is that antidepressant medications work, but that we are in the very early stages of understanding why they work and for whom. How do you present this sort of information when you're up against people who just, like Elon Musk, who say, oh, these don't work, and then people take him for his word?
It's incredibly difficult. It's an uphill battle, like you said, and we see that on social media. It's almost like the algorithms are, well, we know this, they are primed, or they're set up to be to reward information that is oversimplified, emotion-laden, replete with certainty, as you're saying. And in many ways, that's the complete opposite of what happens in academia or in peer-reviewed scientific papers, where, researchers are careful to use tentative language and a lot of nuance, and they want to elucidate the complexity involved. And that's really tough. And that's also what's important to do at the level of patient care too, when we're providing informed consent on the risks and the benefits of treatment. So we need to be forthright about that. And so when a patient will hear nuances or read about nuances in the literature or in primary care or the healthcare system at large, that is a stark contrast to what they'll see on your Instagram reels, or like you said with Elon Musk. And I think in that way, in some ways, we're disadvantaged because that certainty that is presented by health influencers is what appeals to our biases. It's what makes people in part fall for misinformation. And I think that's very dangerous. And so I guess to remedy that is kind of what I'm trying to do, what you're trying to do, what a lot of science communicators are trying to do, which is to say that's not how science works. That's not how healthcare works. Healthcare and science itself is super complex, especially in the area of mental health and chronic diseases, kind of more broadly. And in some ways, that those gaps in knowledge, like we there's so much we don't know about the nature of psychopathology and mental illness. There's so much we don't know about how to improve our treatments. And that's not a bad thing because science is constantly evolving, but that's not what we get in the wellness industry. They'll pitch the idea that they do know what they'll say that they know what they're talking about. Mainstream mental health care doesn't. We have the solution. They don't. And that is incredibly dangerous because it plays upon people's biases. It plays upon poor science literacy skills and poor mental health literacy skills, unfortunately.
And with the influencers, their incentives to make a living are often tied with them going onto social media to talk about these things. But what you identified earlier is something I come across often with actual medical professionals, which is you have a full-time job. When I talk to someone like Danielle Bellardo in cardiology or Jen Gunter in OBGYN, these are people who are in clinics or hospital systems full-time, and then you have to go do science communication later on, which is, from my understanding, for everyone I talk to, really challenging. It's a time suck, but you decided to do it. What made you want to battle misinformation online when you already have a pretty full day?
Thank you for that. Yeah, I mean, number one, I'd say that it's sort of baked into our codes of ethics, at least for clinical psychologists in Canada. One of the principles in our ethical codes is what's called responsibility to society. And what that means is we need to be promoting and practicing evidence-based care and evidence-based practice. In part, what that involves is debunking the opposite, which is debunking mental health misinformation and pseudoscience. So it's part of our codes of ethics. On a more personal level, it started with me during my graduate study days because my dissertation work and my research work, I came from an addictions lab and I was studying the nature of cannabis addiction and just seeing there's a whole subculture on cannabis addiction and the myths around that. And so I noticed even during my practicum placements that a lot of patients, working in an addiction clinic would have a lot of misconceived notions about the nature of cannabis addiction, and they'd hear it in popular culture too. We would see the minority, the substantial minority of people who do happen to develop a cannabis addiction. The vast majority of people who use cannabis won't, but there's a minority, a substantial minority that will. We happen to see them in our clinic. And so it was very hurtful for these people to hear things like, well, it's not a drug, it's just natural, you can't get addicted to it. And so they didn't understand that. And so that's sort of what motivated me at first to kind of write op-eds and articles, just trying to make clear what cannabis addiction is versus, say, an opioid addiction or an alcohol addiction. Then I got on social media, and to be quite honest, I started to see that the misinformation space was so much incredibly larger than cannabis addiction. It extended to addiction misinformation, mental health misinformation, and just health misinformation more broadly. And so that's what that's what motivated my last 5 years or so of doing this kind of work.
One of the biggest challenges I find is the question of intention. because you're always wondering, or we're always wondering, when we come across these anti-vax figures or people just spreading any sort of misinformation, do they really believe it, or do they start off kind of skeptical and get indoctrinated as they go? Do they just see this as an opportunity to make money? I think there's a broad range. I think all those categories are filled by different people, but being able to identify when they're selling their products, it can be quite challenging. And you write that a lot of people are more influenced by poor science literacy than moral bankruptcy. And I really appreciated that line. How, in this environment, do you find effective science literacy gets taught or communicated?
I don't think we do a good job of that. We know from large U.S. surveys that the general public, that poor science literacy is a problem. Not many people know what probability is. They often confuse concepts around the nature of causation and, correlation versus causation, how to identify experiments and what that means. And so I think we do need to do a much better job at teaching science literacy right from the ground up, from, elementary school through to high school. I think that's a big part of it. We also know, though, that, in the misinformation literature, that it's not, poor science literacy skills is a huge component for why people may fall for misinformation, but it's not the whole story. It's not just an information deficit model. We know that so many things also contribute to why people fall for misinformation. And so there's personality proclivities. There's reliance on certain thinking styles, like an intuitive thinking style versus an analytical thinking style deriving from Daniel Kahneman's work. There's propensities toward conspiracy mentality or, other personality traits like openness to experience. There's other variables like a lack of intellectual humility or its converse, which is kind of a narcissistic or narcissism or narcissistic tendencies. And so what we're starting to kind of reveal here is a very complex interacting model for why people fall for misinformation. It's not so straightforward. It's not so black and white. I think that's the picture that we're kind of, that the underlying psychology is painting. It's very complex. There's a lot of interaction, and it's hard to know exactly who will fall for it, but we know that all of these variables matter, and I think we need to attend to them when we're trying to battle misinformation.
So I have my own anecdote in this realm because I suffered from pretty severe anxiety disorder for a long time. I had hundreds of panic attacks to put me in the hospital. And there was a period where it was to the point of crippling. And my general practitioner put me on a benzodiazepine. Even then, I was wary of not wanting to get hooked on something or dependent on something. But it was very helpful for me for about 6 months. And then I was able to wean myself off. During that time, I got pulled into Robert Whitaker's work. I interviewed him. I found him a very nice person to talk to, but I also recognized that Mad in America has become pretty anti-psychiatry, which I think is unfortunate because it comes into that nuance. I think they pull way too far on the over-medicalization, which can be a problem, but it isn't a black or white issue. So in that space, and this is kind of similar to the influencer question we've been discussing, but one issue I see often is that influencers or non-experts like to diagnose either themselves or other people. And I'm wondering if you can address why that can be a problem.
Yeah. And first of all, I'm sorry to hear that, because I know from clinical experience how debilitating panic attacks are. And so I hear that loud and clear. But yeah, I think, the problem with things like Mad in America and sort of the anti-psychiatry movement is that it's sort of, it's like any kind of piece of propaganda. Like, it'll take a kernel of truth and just hype it up to the point of absurdity, to the point that it becomes a cartoon and no longer valid. So yes, things like benzodiazepines are overdiagnosed, and they're maybe not the best thing to do for an anxiety disorder or panic disorder. We at our clinic, we spend a lot of time tapering people off of benzodiazepines and trying to figure out other kinds of treatment. And yeah, over medicalization can be a problem. The thing that the anti-psychiatry movement does, though, is, like you said, it's a pseudoscientific assault on public health, because it will be launching its opinions and pitching its propaganda in places that allow it to thrive in a way that dodges scientific critique. It's not happening in the mainstream top-tier medical journals for the most part. It's happening on websites dedicated to flaming psychiatry, or it's happening on social media, and on blogs and on forums, and then amplified by influencers and amplified by guys, again, like Elon Musk or Andrew Tate. And so I think that's incredibly dangerous. You're back to your question, you said, what's the harm of self-diagnosis or trying to diagnose others? It's like it would be in any kind of health discipline. To diagnose a mental disorder, first of all, requires a license, and that's because a license requires a modicum of training and standards. And so in order to get a license, people need to have an educational background. They need to have a clinical background. They need to essentially know what they're doing so that they can pass the relevant tests, and so that they're legally allowed to diagnose. People who don't do that, they're playing Dr. Google. And that's a very risky thing. And it essentially boils down to, non-experts not knowing what they don't know.
Yeah. Oh, yeah. So in the book, you write about how you deal with patients in terms of, for example, if someone comes to you and saying, I love homeopathy, you don't automatically do what I would probably do, which is start to talk about why homeopathy cannot possibly work. You write that your whole practice is a co-exploration, right? You're not giving advice, but you're working through things with them rather than trying to dictate, which I love. And that is in that environment. Online, what you do more effectively than most any other person who combats misinformation, I found, is you will simply screenshot what people say to you and use some sarcasm sometimes, or share some credible information. How do you balance those? Like, what is your method? I mean, you don't have to talk too much about your clinical practice, because I know that's with the patients. But how do you work with that very caring, empathetic figure that you must be in that environment, as compared to suddenly going online and going into the trenches there and dealing with people who are just, pretty nasty to you?
I really appreciate you saying that, because it's a very delicate dance, and it's a hard balance to do. And one of the reasons that was a motivator for writing my book, was that I'm not able to debunk, say, mental health misinformation and pseudoscience so forthrightly and so kind of bluntly in the context of clinical practice. That's not what we do. My number one priority is to cultivate a therapeutic relationship and to kind of meet the patient where they're at. And the clinical space is not where you do that. I'm wearing a different hat as a clinician. And so writing the book and science communication more generally, was an opportunity to put a different hat on and to help people with their mental health, so to speak, but more distally, more at large, in a way that kind of armed them with these mental health literacy skills, science literacy skills, teaching them the language of pseudoscientific grift and wellness grift. And so, yeah, online, like you, it's a very difficult thing. We don't have a map. I don't know. We don't necessarily have a guide of how to do it. Other than I'm trying to be as professional as I can. At the same time, it's the social media space is a very interesting hybrid of personal and professional lives, and we're learning more about how to navigate that, but it's difficult, and it's going to come down to individual personalities. Like you, a lot of science communicators and me take a ton of trolling and a ton of harassment. And I mean a ton. I probably get on average 100 abusive messages a day across social media platforms. And I wish I was exaggerating that number. Like, it's literally that much. And so learning how to cope with that is an important part. an important component of science communication skills. And so I just try to turn it into a learning and educational opportunity. What's helpful for science communicators, I think, is not taking this stuff personally. Usually when people are attacking us, they're attacking an idealized idea or image of who they think we are. And so I think just having that in mind can really help. And then just using it as an educational opportunity to provide some good information.
One of the ironies I feel is that I already identified my issues with America's for-profit healthcare system. You're in Canada, and even Matthew, my co-host, is in Canada. And a lot of the American grievances around how fucked up our system is, which it is in some ways, and also really good in other ways, to be clear, comes down to the fact that it's so expensive. But you're just operating in a different system. Like, there are up to 500,000 people in America who claim medical bankruptcy every single year. I don't even think that's possible in Canada, unless maybe there's some private practices that I'm not aware of that people fall into. So when people come at you with that argument of it's all about cost, like, how do you respond to that sort of argument when you live in a completely different system?
Again, it's tricky, and I agree, like the U.S. system, I don't know as much about it, but yeah, I think it's far more dire than the Canadian system. That said, the Canadian healthcare system still does have its problems. I think that we do have one of the best healthcare systems in the world because we have, my patients who come to our publicly funded healthcare system do get it for free, and that's fantastic. And we have an army of really skilled mental health professionals, who get to see them. At the same time, there's large wait lists for clinics. Even in primary care, people get 5 to 10 minutes with a family physician. And so, there still are these gaps in our healthcare systems. And I get that. And I think that is the signal to improve these symptoms. I don't have the answers, these systems. I don't have the answers how to do that at the social or systemic level. I don't want to feign expertise outside of my domain as a clinical psychologist. So in part, I wrote the book to try to help people at the individual level to try to protect themselves from all the grift that they're hearing. And I think that's also, as you know, one of the reasons why people will turn to alternative medicine and kind of the wellness industry is because we do have these gaps in our healthcare systems and gaps in our knowledge with respect to the nature of mental illness. And so with such gaps, it allows wellness grifters or pseudoscientific promoters to slither in and kind of open up for business.
One of my favorite lines in your book, and I would love for you to unpack this a little bit, teaching science as belief is, in essence, to teach pseudoscience.
Yes, because it speaks to the idea that science is a constantly iterative process. It also you may see on social media when we talk about the idea of a scientific consensus, this really confuses people because they interpret that to believe that we're the ones who are now falling prey, we're teaching science as scientism or teaching science as religion, and that's just not the case. Scientific consensus is not just believing the consensus of some random scientists or researchers. Scientific consensus is the results of a huge mountain body of scientific studies that all agree with and support each other. For example, all of biology is supporting evolution, right? Or we know that vaccines work and that they're safe because of all of these various scientific studies that agree with and support each other. That doesn't mean that we're believing and praising in vaccines. The spirit of the scientific method is to always be open-minded and to be open to the idea that you can have disconfirming evidence. It needs to happen repeatedly and in a replicable way. And so that's sort of what we mean versus the pseudoscientific, I guess, orientation would be to teach belief. It kind of back to what you said, where Elon Musk is parroting certain ideas or health influencers or Instagram influencers are saying that their treatments work. And and they're really coming at it from a place of belief.
Before we started recording, we talked a little bit about the challenges and pleasures of writing a book. One thing I appreciate is you have this landscape before you where you have to either take different buckets of information that you've researched and studied for so long, or go out and do new research to try to tell a complete story. This is your first book. What did you learn about your own maybe mindset or discipline putting it all together in one place like this?
I'm not going to lie, it was super challenging. It was super rewarding too. I think the biggest learning curve for me, and I think most scientists or researchers who were in academia, is writing for, at least it was my goal for this book, was to write for a large general audience. So you want it to be palatable or accessible or interesting and entertaining to a large audience so that they'll pick it up and then start to learn the messaging that you want to convey. In order to do that, you can't speak like an academic because it's too dry and boring. And so what you have to do is learn, and this was a huge learning curve for me, learn how to weave story with science. And that was I found that the most challenging thing because it was my first book and I have never written kind of in such a way. I've written in articles and op-eds and blogs where you kind of do that on a much more truncated level, but to have that on a book length level was more difficult for me. So I hope I did that in a way that people will find enjoyable, that still conveys the messages that I wanted to convey, which is to really help people learn about mental health misinformation and pseudoscience and protect themselves from it.
I think you did. It's a fantastic book, and you lay out a very compelling narrative. I especially appreciate, as I flagged earlier, the humility in it of, again, just recognizing that as much as we've learned in medicine, I mean, I'm a fan of someone like Roy Porter's work, who's a medical historian. And if you read through the millennia of how we've got here in terms of our understanding of biology and neuroscience, you realize that we've made a lot of advancements. That's really important. As a cancer survivor, I might not be here 10 years after cancer, 150 years ago. But today, that will probably never bother me again. And I was able to get past it relatively easily. That's amazing. And I think sometimes we're just short-sighted because we think everything should be fixed right away. And that's just not how life or biology works, unfortunately. Last question for you. We've talked about some of the challenges of trying to get across good information online. How do you feel, though, 4 years into the pandemic, and we've met a lot of new people in these spaces? I know through my podcast, I know you've been on other podcasts, and there's this network of people who are trying to do this work. Do you have any hopes for the future of science communication?
I try to remain optimistic. That's the optimistic side of me. And to be frank, I don't think things are going well right now, especially with the kind of aftermath or what we're seeing nowadays with COVID-19. I think just the constant revisionism that we've seen, the constant amplification of fringe experts and anti-vaccine movements, anti-psychiatry movements, wellness influencers. I think, again, it's a very uphill battle. And that sucks, to be honest, because this really it's harmful. It can affect people's health decisions. It can affect people's lives and livelihood, and it's dangerous. And so I think the message, though, is rather than retreat from it, I think we do need an army, so to speak, of science communicators that are more organized and willing to go into the trenches, so to speak. I get why people won't do it, and that's fair enough. As we've talked about, there's a lot of trolling and harassment that can come with the territory. People can be chased off social media. It can be very discombobulating to have that happen to people. So I think that science communication itself should be a subdiscipline, say, of various health disciplines where we kind of teach people how to cope with harassment, how to teach science communication in a more formalized way, and to have a stronger network where we can go to those trenches and sort of fight misinformation where it's kind of breeding.